Hello everyone, and welcome to this month's participant webinar entitled Family Health and Self-Care. Everything you need to know to be Dr. Mom or Dr. Dad this summer. This is Gary Sams again, the Chief Wellness Officer for Ebix Benefits Administration and Wellness. And as always, I'm happy to be here with you this month to talk about another important topic, that being self-care. By way of introduction, I want to talk first a little bit about what self-care is, although I have a feeling most of you know what I'm talking about when I talk about self-care, in that it's something that many of us do all of the time. We're going to talk about some specific issues or concerns that typically arise in the summer, like strains and sprains, sunburn, or even swimmer's ear, that we can apply self-care techniques to very effectively. And finally, I'm going to talk about an available resource for practicing medical self-care that I don't think you can do without. It's quite a tool and advantage that we have with our Atom content. Okay, what is medical self-care? Really, it is just what it says. It's taking care of ourselves when we can and when it's appropriate to do so. It's not practicing medicine without a license, not suggesting that in any way. It's just really being a smart, engaged participant in our own care when it comes to particularly treating common concerns that most of us have from time to time. And by way of some facts and some statistics that kind of point out the prevalence of self-care, you might be surprised that over 80% of health problems are treated at home. So as I said in the opening comments, I think this is something that we're all familiar with and that most of us practice and conduct a little medical self-care from time to time. And in fact, again, 80% of health problems are treated at home. You might also be interested to know that 1 in every 5 primary care visits are for common conditions like backaches, headaches, or a cough, not things that are typically life-threatening or require intense, immediate medical attention. So we again have an opportunity to use our self-care skills a lot and effectively. 81% of adults use over-the-counter medicines as a first response to minor ailments. And over-the-counter medicines are a tool in practicing self-care. So an example of that would be taking ibuprofen or aspirin, or maybe an analgesic of some form, or an antihistamine, a cough medicine. These are over-the-counter products that we use for self-care purposes. U.S. consumers make approximately 26 trips a year to purchase over-the-counter products, where by comparison, on average, we see a healthcare practitioner, the doctor's office or nurse or whomever, 3 times per year. So we certainly do more of the self-care activity than we do engaging with the healthcare community on a regular basis. And don't worry that you might think, well, my doctor, I have a close relationship with him. He doesn't want me to practice self-care. He'd rather me come and see him in his office or her in their office. Well, the truth is, most physicians will be honest with you and say, I'd rather you practice good self-care techniques when it's appropriate, and that frees up my time to deal with more of the emergent and serious issues that come to the office. So physicians are all for effective medical self-care, and practicing effective self-care really involves preparation and practice. And so that's a lot of what we're going to talk about today. So let's talk about some specific examples of applying medical self-care, and I'm picking some topic areas, some health issues, if you will, that we typically see in the summer months. And one of those has to do with strains and sprains, because let's face it, most of us are more active in the summer than we are in the other seasons of the year. We're outside more, we may be hiking, playing sports, even working around our homes or other things like that, where we have the opportunity now, because we're using muscles that we haven't used in some time, or we're involved in different activities, we have an opportunity that we can have an injury. And so one of the tried and true methods of treating strains and sprains is summarized in what we call the RICE method. RICE being R-I-C-E. And specifically what that acronym stands for is R, rest. If you have a strain or a sprain, don't believe in the no pain, no gain philosophy or approach to treating an injury like that. Rest is really important. So if you twist an ankle, you want to stay off that ankle for 24 to 48 hours. You want to let it rest so that you don't worsen the issue or the problem. So rest is important. I is for ice. Every training room in the country has ice in it for a reason, because ice is very effective at reducing pain and swelling. So always recommend, as part of your self-care armament and treatment center, if you will, at home, that you have an ice bag. Typically the gel, the soft ice bags are the best if you can have one of those. If you don't, if you have even a bag of frozen peas or frozen vegetables or something like that, that can serve the purpose. But ice is important to have, and so you want to apply the ice to the injury. Let's use the example of we've sprained our knee. So an important note, you don't put the ice, however you're using it, either in the form of the frozen vegetables or a real ice pad or ice pack, directly to the skin. You always want to have some light protective layer between the ice and your skin to prevent frostbite and injuring the skin. So a light washcloth or something of that nature will certainly do it. An absorbent towel of some kind. You want to put that on the skin first, then you put the ice over top the injury. And it's best to keep it on for 10 minutes, take it off for 10 minutes, put it on for 10 minutes. You'll keep repeating that for a while. So that really will make an impact on the swelling and reduce pain from that particular injury. C stands for compression. And by compression, if you have an ACE bandage at home, and I recommend if you don't, that you purchase one, an elastic ACE bandage that you can use for wrapping injuries like this. You want to wrap the injury and compress immediately when an injury happens, and that helps to prevent swelling in the area, which promotes healing and reduces pain. Now, the important issue to consider there is you don't want to wrap too tight. If the area below the wrap is feeling numb, it's tingly, it's cold, God forbid it's turning blue, that means that you're not getting enough blood flow through, so you want to loosen that wrap. So you want to keep it tight enough that you're actually compressing that area, but not too tight. The fourth part of this is the E, and that stands for elevation. And that means trying to raise the injured part. So if it's your knee or ankle, for example, you want to try to get it as close to the level of your heart or higher as possible, because that will help reduce the blood flow as well, help prevent the throbbing that can accompany an injury like that, and reduce swelling. A way to do that is, if you do have an injured knee or ankle, for example, if you can lay on a couch, put a pillow or something under your knee, under your ankle, so that it's raised up. and again, that will help in the healing process. So RICE: rest, ice, compression, elevation. A couple other issues that Dr. Mom and Dr. Dad will have to face in the summer if you have young children, at least I know I always did, was sunburn and swimmer's ear. So let's talk about sunburn for a minute. It's not just children. We all have an opportunity to get more exposure than we should in the summertime. If you get a sunburn, how should you treat that? Again, ideal for self-care. Take a cool shower or bath, or place clean, wet, cool washcloths on the burn. So here are points that you should be using. Do not use products that contain benzocaine or lidocaine, because these can cause allergy in some persons and make the burn worse. If there are blisters, dry bandages can help prevent infection, and never pick or try to disturb the blisters if they're there. It's best to leave them alone, because that will, and that's also in the case of getting a blister even from a resistance blister. Let's say you're out working in the garden and you're using a hoe or a shovel and you haven't done that for some time, and you get a blister on your hand just from the friction and resistance of your skin to the tool. It's best to leave those blisters alone, because the skin covering the blister helps to prevent infection and bacteria and things from entering. So it's best to, again, keep them intact. If your skin is not blistering, moisturizing cream can be applied to help relieve the discomfort, but it's best not to use the old wives' tale of butter or petroleum jelly, Vaseline, or other oil products, because those clog the pores and that doesn't let the heat escape from the injury, which is what we want to do to help preserve the skin below. Creams with vitamin C and E may help limit damage to the skin, so those are okay. Over-the-counter medicines like ibuprofen or acetaminophen can help to relieve the pain from sunburn. Always remember not to give aspirin to children. If it's severe, cortisone creams may help reduce the inflammation, and it's best to wear loose cotton clothing if you do have a burn, so that you're not irritating the skin, and as always, drink lots of water. So that's a tried and true method to treat sunburn. How about swimmer's ear? Another common thing that we can get, because now we're swimming in the summer, and particularly if you're swimming in lakes and streams and oceans and things like that, where there can be more bacteria. How do you treat that issue? First, don't scratch the ears or insert cotton swabs or other objects in the ears. That just introduces more bacteria, or the potential for it, as well as potentially damaging the eardrum. Keep ears clean and dry. Try not to let the water enter the ears when you're showering or shampooing or bathing. If it has gotten wet, try to dry your ear to prevent any kind of bacteria buildup. Avoid swimming in polluted water in the first place if possible, and if you're concerned, use earplugs when swimming. Now, in the case if you do get swimmer's ear, one of the methods or techniques you can help to treat it is try mixing 1 drop of alcohol with 1 drop of white vinegar and placing the mixture into the ear after they get wet. The alcohol and the acid in the vinegar help to prevent bacterial growth. So a little self-care tip there. What about insect bites? That's another opportunity in the summer. We're outside more. We're exposed to insects, mosquitoes, wasps, bees, ticks, all of these things. What should we do? Well, first, wash the site thoroughly with soap and water, and then consider these next steps. Place ice, again wrapped in some form of a washcloth or towel to prevent injury to the skin. Place the ice on the site of the sting for 10 minutes and then off, just like we talked about with the rice method. And that can help reduce swelling and pain. If necessary, take an antihistamine like Benadryl or apply a cream to help reduce the itching. Over the next several days, watch for signs of an infection, such as increasing redness, swelling, or pain. That's particularly true if you're in a wooded area or field and you've been exposed to maybe ticks. As you know, there's an issue more prevalent today of Lyme disease from deer ticks, and typically you see a bullseye rash if you've been exposed to that. And if you see that kind of condition, that's a time that you want to go beyond self-care and get in touch with a health professional to be seen and treated. Other signs that you should be treated by a healthcare professional are, of course, if you have trouble breathing, wheezing, or shortness of breath, could be a sign of allergic reaction. Swelling anywhere on the face or in the mouth, throat tightness or difficult swallowing, feeling weak or turning blue. These are all indications that you need to be seen quickly. So in regard to self-care in general, what should we be doing? As I mentioned, we have a great asset as a part of our offerings at Ebix, Benefits Administration and Wellness, and that is the ADAM content, the medical self-care content that in our system it's called Health Answers. You might be exposed to it through another format, but in general it all works the same. Health Answers is over 5,000 articles of trusted health information that you can access, and it's a great tool for practicing and resource for practicing medical self-care. You can go to it first and look at what the home treatments and the issues are to get information of whether you should be seen by a healthcare professional or not. It really is a great opportunity to save time and money and be a real effective consumer of healthcare by being more educated about issues and areas of concern. What I've done on the screen, if you can see it, is to show what the Health Answers section looks like within our system. But however, again, you're accessing it, all you need to do is to type in the search box where the magnifying glass is your particular concern. So in this case, I type in sunburn, and a whole list of articles addressing sunburn come up. And the most prominent or most often used ones appear first. So on that page, you'll see a definition of the issue, the things that you should consider, the causes, and we even have a video there of how to treat sunburn. So everything that you need to address that issue is right there in the Health Answers and the self-care information. So in closing, I want to thank you for your time and attention. As always, please take advantage of these resources to be a better consumer of healthcare information and healthcare in general. We're all practicing self-care just about every day in one form or another, because when you think of it, brushing our teeth is a form of self-care. We do that to prevent cavities and to have good oral health. If you take over-the-counter medicines like an aspirin or those types of things, that's all self-care. But when it comes to specific issues that we have an opportunity to address in the summer, like strains, sprains, sunburns, insect bites, you name it, the self-care guide that we have within the ADAM content, Health Answers, is just a great resource to utilize to get the good, sound, solid information that you can trust in a timely manner. So wishing you a healthy and happy summer, and hopefully not needing to use the self-care information for any problems, but maybe just for preventative reasons. So thank you again, and look forward to speaking with you next time.